I have been approached from people all over the world about masks, and I was actually warned by friends to not talk about masks, even though I'm right. That was their words. Because they were afraid for me. Because people need to think that they have some control over this illness. And if somebody says or proves that masks do not work, then you have no control over this illness from something very easy. And I want to start by saying, I wish masks worked. I really wish masks worked. And I am a doctor, and I've done hundreds of medical procedures wearing surgical masks. And that's hundreds more than anyone in the task force, by the way. And I wore a mask. Why? Because masks stop people from coughing or sneezing or spitting into an open wound that is sterile. They also stop blood from spattering from a patient into your face. That's why you wear a mask. There is zero doctor, if there is a doctor who thinks they're wearing a mask to stop the spread of an infection, there's something really, that is just, I don't even know how to say what that is. Masks have nothing to do with infections when doctors are wearing them. Okay, so that argument is just really irrelevant. Masks block particles. That has been proven by many, many different particle studies. And I'm sure people have read these studies because this is the evidence that is cited that masks work to stop COVID. And there are many particle studies, and I've been shown them many times about particles being blown through masks versus not without a mask. The FAA studies that I was privy to on spread of infection in airlines were all based on particle studies in robots. I had the pleasure of listening to this on the phone in my office in Washington. But particles are not infections. The painful truth about masks for COVID is that SARS-2 spreads by aerosol mainly, not by large droplets. So it goes around a mask. When you wear, if I do wear sunglasses when I'm wearing a mask and I see my sunglasses fog up, what do you think's going on there? Okay, your breath is going around the mask. The size of this virus is smaller than the pore in a surgical mask. Smaller. You don't have to be a genius to think that, hey, maybe the mask might not stop that virus. And third, masks have known harms. Now, how do I know they have harms? Well, they've been outlined by the World Health Organization. I don't know if it's still up there. They have a tendency to take down stuff. But if you look at their document, you will see a list of harms from masks. And the mask harms are coming out now more and more, including psychological. Any parent who thinks that their child, their young child doesn't learn speech or from emotion or socialization, and they think they can do that with a mask. I just, I'm not sure about that. But the most important harm from people like the head of the CDC holding up a mask and saying this mask is better than a vaccine is that makes old people who could die think they're protected from a mask when they're not. Now, how do I know they're not? Well, I have three categories of research. Scientific research that was done early or just before this pandemic, observed empirical evidence from all over the world, and then scientific research that was done later in the pandemic. And I'm going to go through a little bit of it. Research early in the pandemic. Harvard Medical School's April 2020, New England Journal, on masking for healthcare workers. Quote, "We know that wearing a mask outside of healthcare facilities offers little, if any, protection from infection. In many cases, a desire for widespread masking is a reflexive reaction to anxiety over the pandemic," unquote. CDC's May 2020 review of all research studies in influenza pandemics. Now, why would I say influenza? Because influenza was studied ad nauseum for masks, and influenza virus is essentially the same size as SARS-2 virus. That's important. It's an upper respiratory infection, as you know. Quote, "We did not," this is CDC, "we did not find evidence that surgical type face masks are effective in reducing laboratory-confirmed influenza transmission, either when worn by infected people, source control, or by people in the general community to reduce their own susceptibility. WHO's document, quote, advice on the use of masks in the context of COVID-19, which I quoted on Twitter, and the tweet was removed for this quote. At present, there is no direct evidence from studies on COVID-19 and in healthy people in the community on the effectiveness of universal masking of healthy people in the community to prevent infection with respiratory viruses, including COVID-19, unquote. That document had this exact same phrase in December of 2020. University of Oxford Center for Evidence-Based Medicine, July 2020, reviewed all the literature and said, quote, despite 2 decades of pandemic preparedness, there is considerable uncertainty as to the value of wearing masks, unquote. And then Jefferson posted a November 2020 review of the 9 published trials on masks for influenza and said the results of randomized trials do not show a clear reduction in respiratory viral infection with the use of medical surgical masks during seasonal influenza. What about the empirical evidence? That was all known about masks. The empirical evidence during the pandemic, which had accrued, by the way, by the time I got to Washington in August. Alabama, mask mandate, that's cases. The mask mandate was not removed, by the way, in any of these. Okay, mask mandates, cases exploded over the next few months. California, mask mandates, cases exploded. Hawaii, mask mandates, cases exploded. Los Angeles County, mask mandates, cases exploded. Miami-Dade County, mask mandate, cases exploded. Michigan, mask mandate, cases exploded. New Jersey, same. New York, mask mandate, by the way, put on after the cases were coming down. Cases exploded. Rhode Island, mask mandate, cases exploded. That's empirical evidence, that's observational. You might say, well, but people weren't wearing masks. Mask mandates, so what? Nobody's wearing a mask. Okay, people, if you've walked around California, this is at this stage, after vaccinations, you still see people wearing masks. Look around Stanford Mall, but in any event, you think, okay, people weren't wearing masks. Okay, well, no. This is YouGov. The dots here are percentage of people wearing masks. And this is validated by the Pew, Gallup, COVID Consortium, CDC surveys. 80 to 90% of people were wearing masks in the United States. And that's similar to that in Europe and approaches that in Asia. And what do we see that I came in August, by the way, and you could see from the timeline, I wasn't able to convince anybody to not wear a mask because the mask usage stayed high, and that's fine, but the cases exploded. This is all US states. Mask mandate states versus states without a mask mandate, cases per day. That's empirical evidence from the US. Well, okay, but I don't believe Americans are really wearing masks. Let's go to Europe. Okay, Austria, mask mandate, cases exploded. Belgium, mask mandate, cases exploded. France, mask mandate, cases exploded. Israel, mask mandates with fines, cases exploded. Italy, mask mandates with fines, cases exploded. Portugal, mask mandate, cases exploded. What about Asia? Japan, everybody's wearing a mask there. 96%, 97%, 98% mask compliance. Cases exploded more than once. South Korea, 99% compliance, cases exploded. That's the empirical evidence. What about the research that came on later? Denmark. My friend from Denmark here in the front rows knows this study. This study took months to get accepted by journals. I know because I was hearing from the authors of the study. Okay, the study was blocked, but they finally published it. What did the study show? It's the only randomized controlled study of masks for this virus. And there were over 6,000 adults participating in the study. And they used high-quality surgical masks. And the results are the following. No reduction in SARS-2 infection between the mask and no mask groups. No reduction in SARS-2 infection if limited to those who wore masks, quote, exactly as instructed, unquote. No reduction in any of the other 11 viruses studied. They didn't just study this, they studied 12 viruses by testing, including influenza, no difference in the masked group versus the unmasked group. Oxford's Hennigan and Jefferson analyzed that study and concluded the evidence shows that wearing masks in the community does not significantly reduce the rates of infection. Oops. One more study, University of Louisville. This is another study that was blocked from being published, but they finally did. CDC data, May 2021, all the seasons of peaks during the United States during 2020, all states were analyzed, their results. Mask mandates were not associated with lower SARS-2 spread. That's mask mandates. Mask usage was not associated with lower SARS-2 spread. That's usage. Mask mandates did induce a greater compliance in mask usage, but not a lower growth rate of infection, whether the community spread was high or low. The summary of the data was our findings do not support the hypothesis that SARS-2 COVID transmission rates decrease with greater public mask use. Okay? The earth is round. It doesn't have to keep being proven.